Hello there. A very good evening to all our change makers today. Very fun guest today, someone very close to me. His name is Dr. Naveen, and he's a dermatologist by profession. Welcome, Naveen. Thank you for coming today.
Thanks for having me.
So, I mean, very happy to be doing this with you today, especially because
the relationship we share and everything.
Yeah,
what have you.
Yeah. And of course, I think the very interesting journey that you have had.
I
think
long,
it'll
long and arduous.
Yeah. Very fun for the viewers today to understand. So tell me, where were you? Where did you grow up?
I was born in Mumbai,
Okay.
and I was taken to America when I was 6 months old.
Okay.
And I grew up there till I was 18. Somehow fate made me come back to India. And I studied my MBBS here in Hyderabad and completed it from Deccan. My future wife, and then we got married, and then we decided to continue and pursue our MD dermatology, and we chose the prestigious Ramchandra Institute in Chennai, in which we did our 3 years, and then after that we decided to do 1 year rural service for Gandhi Medical College, is a government hospital here in Hyderabad. Following which we started our own private practice together, and we decided to call it Nava after ourselves, Naveen Atluru, Atluru.
Wait, I have to stop you before you jump into. How come you came to India? Most people go to America to study.
So I was a brilliant student in high school. Very, very well. Good student, did really well on my SATs, had a good GPA, what have you. Got into a straight 7-year med program.
Wow.
And once I started that, I realized that it's just like IIT here, I feel. Everyone works really hard to get into IIT. Once they get into IIT, they don't work anymore. Same with me, we worked really hard to get into the programs, and then after I got in, I guess I paid attention to more other things than work and what have you. So then my dad, at that point, was deciding, do you want to continue here, bring up your grades, and finish off, or do you want to go to India? And I don't know, I don't say rebel.
But why India? Why what was the...
where else am I going to go? Where else are they going to send me? So India was the only option. At that time, they had medical school for 4.5 years, and it's much shorter than doing 8 years or 7 years in America. So we decided India would be an apt choice. One, because we're from here. Two, we have connections who can
Family.
give us a place to stay, someone to support me. Just dropping someone who grew up in America for 18 years, coming into India at 2005 with the culture shock they had,
How was the culture shock? It's actually very fun because most people I interact with,
It wasn't bad. The first thing that really was big for me was watching a Telugu movie called Super. I didn't know the industry went from a movie like Mavi Chiguru to Super.
What is Mavi Chiguru?
It's a Jagapati Babu movie that I saw last time in '95 when I was in India. So going from there to Super, I realized, so things are changing, people are more aware, and they're ripping off of other movies, what have you. And then I stayed with my cousins here, and I made a good group of friends. I guess I can say I was blessed in whatever it was in MBBS or PG. The batch I joined was a very good group of guys and girls, and good friends. They would motivate you to study even if they had fun. If I joined 1 year later, I would have been in definite backlogs in this, and I wouldn't have cared, and a lot more NRIs in those batches.
So they really helped you.
Yeah, I can name 3 names off the bat who I can say thanks to for making me get through MBBS for sure. But it was a fun time. It was interesting. I would say 60% of my time was involved trying to make my relationship get better, and the other 40% was just trying to pass medicine, And it was good.
Was it tough?
No.
The whole journey?
It's not. It's tough just before exams. The rest of the time here, it's very easy. I wouldn't say easy. It's just that dedicated students study year-round. Other students study before exams. Crammers will always be crammers. People who work hard will work hard. In the end of the day,
which one are you actually?
I was definitely more in the end, the tail end, last minute studying.
But you got through.
It for me, the more amount you can absorb in a shorter period of time, then studying something over a long period of time will be easier. It works true for any other types of programs and what have you.
But then you got into something that you really started enjoying, right?
I thought in my whole life I would be a dentist. Since I was a kid, I thought I was going to be a dentist, orthodontist, something like that. And then my parents told me not every dentist is your dentist. And it took me a while to understand what that meant and what have you. And then I understood. And then they're like, a doctor will always have a job, regardless. There will always be sick people in the world. There will always be something that you can help, some sort of job. So I always liked doing something with my hands. I did not want to sit behind a desk and be idle and just talk to patients. Fast forward 10 years, that's all I do. Sit behind a desk and talk to patients. I get to work with my hands a little, but obviously something more surgery oriented would be much better. And but medicine is a great field. But
so how did you get into dermatology, in terms of?
So medicine itself, I grew up in a family full of doctors. My parents are doctors, my aunts and uncles are doctors, my cousins are doctors, every single person in my family but my sister is a doctor. So growing up in an environment, even if I didn't do medicine, I would still feel I would have been obligated to marry someone who was a doctor, at least to just stay in that type of trend. So it was sort of instilled in me since a young age. My parents coming from humble beginnings and then becoming big time doctors in America, they felt that it was their urge to instill in me that, if you don't study, you're not going to succeed in life. So work hard. There's not really work hard, play hard. It was just work hard, work hard. So I had to study a lot.
But you did both anyway.
I definitely play hard. Yeah, that's for sure. But yeah, work was good. Becoming a doctor is in its own way rewarding. It takes its toll on you in many aspects in terms of how much hours you have to put in for studying. And the biggest thing that I saw as a difference is my friends who were the same age as me who are not doctors, exactly, were earning much more money than I was and doing had their own hours, didn't have to listen to their parents.
The whole life journey is different, right?
Of course. And here in this type of field, we are especially in this country,
you're studying for the longest.
Not studying, we're supported by others, which is a big thing in your mind. It hits you when will I become independent? When will I be able to take care of my own? Pay for my groceries, pay for my gas, whatever it is. So that's a big thing. So when coming into medicine in India, we sort of knew that was be there for a while. And, it's not like we have student loans to pay off. We have parental loans to pay off, I guess you can call it.
Only in the mind.
Only in the mind, exactly.
How did that play out for you in terms of finishing medicine and then wanting to start something of your own? And
I did well. I did okay, but the last year gave me a big hiccup. So I had to, and then me and my wife, we took 2 years off before starting our career, what we wanted to do. So we traveled, we had fun, we enjoyed. Well, what I would suggest any couple to do: live alone together, and that's the only way you'll get to know each other better. Living in another person's house under their rules, you won't get the freedom you want. So then finally we decided, let's just come back to India and pursue a career in which a field where we can have a very good family life. Have it itself be an end branch. There's no more super specialty on top of that, and be able to have a decent living in what we do, earn payment wise. So in the beginning, we both thought that my wife would do dermatology, and I would do something in surgical side. Then I had to take a step back and talk to myself and say, listen, you're not going to study for 3 more years that need to be after doing surgery, then doing another super specialty. I realized it's not going to happen. So then I decided, let's just do an end branch, which is like derm or radiology, anesthesiology, some end branch. And we both decided if we're going to do something, let's both do the same thing so that whatever finances we funnel into it later in the future, it's for the same purpose.
Like a joint...
like a joint venture, what have you. So we both chose...
Like in marriage.
Yeah, like in marriage. So since 2006, my wife and I have been together in MBBS, then break, then postgrad, then clinic, then work and children and life.
How did that... Tell me about the clinic. It's really exciting what's been happening. But before you get to the clinic, I do want to touch upon some very interesting projects that you've taken up in terms of doing adverts and doing advertisements.
So I don't know. I don't know what you would say. Is it something that's instilled in someone as a kid or what? But growing up as a kid, my dad is a huge NTR fan, an A&R fan, and he loved watching movies. Even in his medical college, he used to act and stuff like that. So as a kid, he would make us do natak skits, dances, stuff like that, what have you. So that sort of got into me in the sense it's fun to be on stage. People look, watch, whatever, something. So I don't say I was a clown, a goofball or whatever, but I would always want to get attention. I guess I'm not attention gainer, but I want the spotlight on me and something, talk about me, talk about me, or do something that will entertain others because of what I did.
Yeah.
People always said I was like a kind guy. I like to give help and something, but I was like, all right, leave the kindness aside. Let's be something more. So if I got an opportunity, I try an audition, I try something just to see how it would be behind it.
So it was in you.
Yeah, and then I had help from a friend named Vamcast who hooked me up with some jobs, But it was fun. It was a great experience. I never got to be behind a camera to do an ad or a TV shoot or anything, and it was. I give 100,001 props to anyone who can do it, but in that industry, the best is lighting boys.
Yeah.
I've never seen lighting people work how they do in a movie.
In movies.
Oh, it's ridiculous. It's a great thing to do. It's a hobby. It's a habit. I would like to make a habit. Like on the side, something to do. And there are other things that I like,
So there's a reason why I asked that first, because it relates directly to what you do, right? To look good.
To look good.
And you're crediting lighting guys a lot.
Yeah.
Let's draw it down to you now, right? From there.
I like acting. I don't mind acting. It's fun to do. It's not about the money because I'm not getting paid. It's not about the fame because I don't see more jobs coming my way. It's more about just being able to be someone else in the moment because, I don't know, I always compare it to an airplane flight. If you're traveling abroad and you're sitting next to two people, you can be those people you'll never see again in your life.
Sure.
You can be anyone you want that day. Just for that 18-hour flight or 10-hour flight or 5-hour, whatever it is. So what do you do for a living? Oh, I'm an astrophysicist. I work at Caltech, and I'm a genius. No, really cool. You can be anything. So same in acting, whatever you have it. It seems very interesting that you can pursue a role that lets you be anyone, and no one will judge you for the words that come out of your mouth, the actions you do, because it's all in screen. And then getting in and out of that role is a difficulty in itself. Obviously, commercials are not really crazy things where you need to really dive in and really think depth of a character. But doing something like that, it's cool. And I don't know, ever since I was a kid, I'd look into a mirror and make funny faces, do something that would.
You have become.
I stare at my face a lot.
Yeah, you're literally everywhere, and it's a great endorsement because you can really pull it off, and you look good on screen.
Yeah.
Drawing it down straight to Nava now. Tell me about clinic. What is Nava? Where did it all start?
So whatever it was I was going to do in life, I was thinking something along the lines of that it would have to have the name of it or whatever it is would have to be around the people involved in it. So for me, it was me and Ritika, my wife. So we both were involved in it, and Nava's our initials technically. And then we just so happened to name our children with A's, so it's all four of us. Yeah.
How nice.
So you asked what is Nava, the name. Now what is Nava as a brand, a company, a tag team couple dermatologist, who wants to be a power couple in dermatology, want to push the boundaries and types of treatments that can be done in a very safe and, I would say, giving you all options. As a lawyer, obligated to present to you all deals. Same way as a dermatologist, we want to give you all options, even if we may not have it and have to refer you somewhere else. Or, we're not looking for the quick dime or what have you. We want the skin is something that it's not like a blood pressure tablet. You take it immediately, your blood pressure drops, it's done. It may take some time, but if you stick through it, then you can see. I always say to my patients, it's 30% me, 70% you. We do a little bit of the work, but the most comes when you go home, when you follow the regimes that you have to do from...
I have to interrupt there because how much importance do people give to skin first of all? I mean, based on what?
I wouldn't say how much importance people give to skin. I would say how much importance do people give to their looks.
Okay.
That I would say if you ask a general census, it's pretty high up there. A lot of people care.
Okay.
There are obviously some select few that have such bad acne. They're like, all right, I live with it. It will go away eventually, something like that. They deal with it, But there are people who are on the other extreme. Like even one blemish on their face means a lot to them.
Yeah.
So it depends on how you yourself take yourself as a person. Are you really that self-obsessed? Are you not, I shouldn't say obsessed, caring about like how your appearance is? Does it matter to you? Do you go to a job every day that requires you to be in this type of way? There's some people who are, you go to a mall and you see these people putting on makeup for these as samples. But if you see how much makeup those people themselves put on, you can see that they themselves are trying to hide so much. If they...
And that's why they're selling the makeup.
Selling the makeup, exactly. So usually with skin treatments, the whole point is once you do these things and you get better and better skin, and you reduce the need for these outside sources of enhancement, I guess you can say. Of course, we ourselves do a lot of enhancement with whether it's a toxin, botulinum toxin, or hyaluronic acid fillers, or chemical peels, or laser surgeries, or whatever, anything.
Sure.
But all of that is to benefit you for pretty much the whole thing is reverse aging, right?
So
that's the end result.
With treatment, like you would get something with makeup?
Treatment in the sense the finish that you would get is smoother, tighter, brighter skin.
Okay.
On that, obviously to maintain it, you have to use a good cleanser,
Okay.
a toner, a serum, face wash, what have you, and then a sunscreen.
Sure.
On top of this, if you feel that you need more enhancement, you want to put some contour, you want to put an eyeliner, you want to put some eyeshadow, whatever, that's on you or it's a person to do it. But the whole point is to minimize the need of it. So once you yourself get clear, bright skin, what's the point in putting blush if you yourself, would...
You're naturally...
Exactly.
So you can achieve...
natural beauty. That's a natural, beautiful you. That's our theme and what we want to make it. And it should be, you're getting treatments done to get you back to what you were when you were, say, much more better tensile strength in your skin. So I always compare it to say, like, take yourself now, if you're, say, above 30, and look at your pictures when you were 15 or 16.
Sure.
At that point, you are living in your parents' house. They're feeding you the best food that you can get. Every day, you're getting your multivitamin that your mom would shove down your throat.
Yeah.
Every day, you're eating a fruit or vegetable that would be packed in your lunch bag. Those things go out the window, those habits. And on top of that, in our day, we were, as younger kids, we didn't have the tech to sit at home. For us, enjoyment was going outside, play baseball, play some sport, run, ride a bike, whatever it is.
Yeah.
That makes you sweat, that makes you drink more water. So the more hydration you get, the better your skin is. So all this plays in effect. So if you look at yourself when you're 15, the lifestyle habits you had then compared to the lifestyle habits you have 15 years later, you would see a drastic increase of your intake. So whatever you put inside your body will reflect on your skin, obviously.
Sure.
So the more hydrated you are, the more sunscreen you use, and especially in a country like this in India, where the sun is beaming down on you 24/7, and on top of that, you also have lots of pollution and stuff where people go on bikes and they don't use protection as well as they could. They age faster. They photo age faster.
Yeah.
So to reverse those photo aging process, it takes more time, and it starts with you. You yourself have to make it in your mind. Okay, I want to get better. So I came to the doctor. The doctor is going to give me some advice, but I have to follow it. So that whole thing has to come full circle, and you have to think in your mind, from now on, I will do what is required, at least to stop getting worse from where you are. To reverse all of that, I say it took 15 years to get there. It's not going to happen overnight. You got to give it 5, 7 to a year, months to a year, or something like that. And slowly, you'll reverse the signs of aging.
So it's like
maintenance,
repeating an action.
Yeah, I say it's the best way to examine. You go to a car wash, you get your car washed, waxed, and everything, and then you maintain it. You keep it clean. You do it. That wash that you got that day will maybe last 10 to 12 days if you do it really well. 10 to 15. Translate that into skin, it would be 10 to 12 months to a year. If you drive it through a muddy terrain, the day after you get it, it's all gone. You got to do it all over again. Same thing.
So how bad do you think is the atmosphere around us affecting our skin now?
I would say it's pretty. The worst damage comes from the sunlight, along with other factors like environmental factors, like the pollution, along with internal factors, whether you're a smoker, you're a drinker, you don't drink a lot of water, you're not hydrated, you don't use sunscreen, especially in winter climates, it gets colder, so people don't feel the need to drink as much water. So get drier skin, and then they, stuff like that. So does the environment affect our skin? Of course, it's environmental pathogens are everywhere.
Yeah.
Many skin diseases is based on environment. Take for example, for a general autoimmune disorder called psoriasis. Psoriasis is a clinical disorder which patients get silvery plaque scales all across their body, and it has lots of scaling and shedding. And you lose up to like 3.6 grams of protein a day in these scales. So they become very emaciated and loss of weight. So in that you have genetic, environment, trauma, smoking, diet, there's so many different factors that play a role. So many diseases, many things, of course, environment plays a huge factor.
So it's like sunscreen.
Don't live in a bubble boy type of effect if that's what you're trying to ask. No, obviously that's not possible. But you should definitely at least avoid the stress factors or triggers that are causing these. Say you have acne and you get it when you eat chocolate, or you're working in a kitchen as like a McDonald's waiter and you're getting more acne. You got to omit from those causes. That's it.
So let's get into the business part of it, right?
Oh God.
How did you knowing the subject, studying it
is different,
and practically using it is one part of the game, right?
Of course.
What about like the entire other half of it?
So I'll just start by saying this. My sister is a finance student.
Okay.
She did her MBA in finance and is like knows how to play the stock market, knows many things that I've never even heard of. She knows.
Okay.
This is because my dad showed interest in her to teach her, and she learned it. I never learned anything in regards to this. I didn't even know what simple terms like revenue or income. Leave income, but I don't even know more words other than revenue to even say. You know, that's the level of knowledge that I had starting off with. When I started, I would think that even someone giving like 10,000 rupees was a big deal, and I would only calculate it as income. I didn't realize that there's something like an overhead. You know, you have to pay back these people, your salary is this and that. I was just trying to look at my initial investment. Am I meeting it? You know, I didn't look at how to maintain it, to keep it going and on. And I have no business experience. I'm very, very fortunate that I'm surrounded by people who are very talented in that and can give some advice when needed. But as a dermatological practice, there are courses where they give to say how to grow your practice or how to influence others to come to you instead of the neighboring clinic or what have you. So to build a practice, to build your clientele, to build your people who want to make you say that you are my doctor. I trust you. Wherever you are, I will come. There are dermatologists like that they'll have people, if they're in Delhi, they'll fly from Mumbai to Delhi just to get a treatment from that guy.
From that dermatologist?
Yeah, just from that one doctor, regardless of the same cost of the medicine anywhere else in the country. So to get that level of trust and everything, that's in communication skills. Making that, convert it into a financial game where you're trying to get income for what you're selling. For me, being a very passive guy and not being so aggressive in that field, if someone's sitting across the table from you and says, "Hey, listen,
I think that's incorrect. I have to interrupt. I don't think you're not aggressive in terms of work and attitude. I mean, you probably are aggressive at work, even though you may not be aggressive.
I'm aggressive in the work. I'm not aggressive in collecting fees. If someone says, "I'll pay you next week," I'm like, "All right, no problem, man. I trust you." You know, I have a very easy trust factor in many individuals.
So you
learn the business game pretty hardcore. It's a big game that I have to.
It's a good transition, I suppose.
Something that I've never experienced, never had to even keep tabs of. I never had I can say a monthly allowance or weekly allowance even as a kid to know that, okay, this is worth this much, you know, that I should allocate these funds for this thing.
So it must be like
I said
like
in the beginning,
ocean,
you know, in the beginning, as I said it, like, if you're becoming a doctor in India, just know your parents are going to take care of you for a very long time. But after that, then it comes back down to you. So it takes a while to get the hang of it, and I'm fortunate, like I said, to have people around me who can help me.
What has been your learnings in terms of, like, you know, setting up a business? What's been your experience, right?
So the biggest experience I see thing is that, I've also heard from other people, is people don't like paying for healthcare. They really don't like it, Vamsi. You know, if you go for a knee transplant and the doctor says it's $3,000 or 3 lakhs or whatever, and they'll say, "Oh, give me some 10%, 15%." Immediately, the first thing they say is, "What's the best price?"
That's like a general
mentality. When you ask me, I say, "Okay." You know, I don't know how to say no. I don't know how to say, you know, listen, this is the price. You have to understand.
I think that comes
in training,
over time,
of course, and more and more interactions will lead to running the business itself. You have to see how the engine works before you feed it more fuel to let it go longer. So for me, in the beginning when I started with just me, one guy, seeing how a patient comes in, how they are seated, how they come to you, how they interact.
You actually built it like from scratch, right?
Yeah, I tried really hard. It's still in the scratching phase. It's slowly building, but so we started just me and my wife and one guy as a receptionist. Actually, that too. I would say it was just me in the beginning. I would be the receptionist. I would be the guy giving the treatment. I would be the doctor writing the prescription. I would be the guy collecting the money. I would be the guy saying bye. So all 5 points, whatever they're going through, it's just through me. So they know once you talk to me, you can understand what type of person I am, how I am interacting. So to get these type of experiences in terms of finance or allocating. Allocating is a keyword that I like. People like to use. Allocating these jobs and getting people on their game the way I would want it done. That's where I'm finding like businesses where that's where the fine tuning occurs. If you can fine tune your engine in that way, like make sure that this happens at this point. If your client is happy, life is happy, something like that, same thing. Wife happy, life happy.
Yeah.
So if it works like that and it's going on in its own way, then it's okay. It's not bad.
So what are you trying to, build now? Like what's happening?
Okay, in terms of as a skin clinic, I'm trying to start a private practice where I build a decent client base where they come to me, and whether it's clinical or aesthetic dermatology or venereology, that they feel that they can trust us enough to get a good prescription, to get good treatment, and come back for a follow-up. Getting them to return and continuing the treatment and seeing what they're doing and having them being happy with the treatment, that's the biggest thing that we want.
Sorry, so who's like your clients? Like who should technically be coming to Nava Skin and Body?
It's aesthetic or clinical. So clinical dermatology, anyone can come.
Okay.
Anyone is more than welcome to walk in the door if they have some itch or they have acne or they have dandruff or any type of skin lesion, tanning or pigmentation or anything. Or
basic to
from clinical dermatology, anything basic, autoimmune diseases, genodermatosis.
So like you all the practical
it was 3 years
examinations.
of for sure.
Wow.
When it comes to aesthetics, again, I would say anyone can come. And I, to be honest, as a business person and starting from beginning, I don't have any caps on pricing. I am very flexible. I love working with the patient. They say, listen, this is my budget. I said, done, whatever your budget
fits in that.
Yeah, exactly. We try to work around it.
Yeah.
And we always try, if it's aesthetic, to treat what their issue is. If they come say, I have this pigmentation on my face, but I see hair on the face and I know I have to remove that first before this, I'll offer it to them, but my main concern is removing what they came for. You have to manage their expectations in a way such that you don't give them grandiose ideas.
How do you see the market, right? Like where do you feel people's understanding of
skincare and stuff. Especially now with Instagram, YouTube, Facebook, and all these new social media type things. In America or anywhere else in the world, everyone is proud to show off they're getting stuff done to their skin. In, I guess, a little bit more conservative countries, they don't want anyone to know they're getting anything done. They just want to say it's happened naturally. I don't know, something happened, I just got better looking, sorry, Whereas abroad, they'll videotape what's being done to them, throw it up on Instagram and so make that awareness. I got skin resurfaced, I got my scars removed, I got this vampire facelift or whatever you want to call it. So we offer all
this cultural thing, of course.
Exactly. There are some people here too who would love to blast it, saying I got the body contouring done and I lost 7 kgs because of this. Why not? If you're doing a decent job for yourself, why not be here? Exactly. So I would say,
so what would you,
the market, like you asked, people who are obviously in their cine industry or in a high political influence or who have to make repetitive appearances in front of cameras or they're just public, or people always have their eye on them. That would be a good target audience for sure. That they have something going on with them, they want to get it cleared up because many people are watching, of course.
Not only that, I think you said last time, I think the flashes and the repeated exposure to strong lights and all that also has an effect on the skin.
The post-treatment,
right?
Mostly, So say like you're a computer techie working in an IT company and your hours are 8 p.m. to 8 a.m. You're pretty much sitting in front of a computer screen like for 10 hours out of the 12 hours. So that light itself also creates photo damage over time. This is not just 1 day, 2 days. These guys have been working for 10, 12 years. That also will create photo damage. Say someone who is a cardiologist and works in a cath lab where they inject radioactive dyes to see where blood vessels are clogged. Over time, they'll develop radiation exposure and get pigmentation. There's different types of jobs which lead to different types of lesions or things on their skin. So like I said, target audience is anyone, pretty much. You can have anyone as a target audience. It's just on the client, does it bother them? Do they want to do something about it? Or do they feel that...
Is it a need or a necessity?
Is it a necessity or like a want? Exactly,
right?
So we are here to push that, I guess I'm not really bothered by it to a point, to make them aware like, hey, not that you should be bothered by it, but why don't you see how it would look if it wasn't there and then see? Take for example someone who has no hair but then gets a hair transplant. They took years to think about it. Am I going to get it? Am I going to get it? Once they get it, they're like, oh my God, why didn't I do it like 10 years earlier for the change?
Sure.
So it's just converting clients. I was once told by a colleague of mine that there are 3 classes of doctors,
Okay.
A, B, C. An A doctor will sell a product or a procedure which is worth 1,000 rupees for 10,000.
Sure.
The B doctor will sell it for 5, and the C will sell it 1,000 for 1,200. You know what I mean? It's on how well you convert with the patient, how well you make them feel comfortable, how well you make them trust you. At the same time, the pampering services or whatever you have to add on, how well you can convey to them that you have confidence in what you're doing. My tech will work, my skill will work, my technique that I've learned here, and using the devices that I have will make it much more better for you than you going to other places because my experience is better than yours or what have you. Obviously, there are many competitors in this field. Every other corner of the city, you have some dermatologist opening shop. It's one of the most sought out after fields in medicine now. The PG degree out, I mean, like getting
how do you differentiate yourself from?
I don't say I differentiate, but they will differentiate, saying he's not a real doctor type. You know, they'll say that because it's they don't see the clinical aspect; they just see the aesthetic.
Like with regard to the multiple dermatology clinics coming up, right? How do you differentiate?
One is 2 of us
from them. Yeah.
The biggest thing that I have in my thing is that both of us are dermatologists. Both of us trained in the same places and did everything together. Number 2 is that want to give off a view where we don't want to look at it for generating income purposes. We want to develop a good client base in which they can come and say, hey, listen, they didn't charge much.
It wasn't commercial, it was actually
it was a more personal, if you go to your general practitioner doctor and you have some cough or you have a stomach ache and you go to that doctor takes about like 10 to 15 minutes, maybe less, sits with you, understands your whole thing, gives a good history, gives you the medicine, and you're out the door. For us, it's a much more longer consult. It's not something that happens in 10-15 minutes. You know, we take like 45 minutes, they sit with us, they converse with us, they get to know who we are, and they take their time to understand, okay, so these are the services that are provided, and they understand. And we want to give off a view where people can just think that, okay, they are a family practice for a family dermatology. So not just for you, maybe your spouse, maybe your children, maybe your grandparents. You know, it's not just aesthetic, it's clinical. Every place that you go here, other than maybe ones that are not like more remote areas, they're all pushing aesthetics because that's where the money is, to be honest. But there are doctors who in this part of town who have been working only in clinical derm since the age of, since the beginning, and they've earned beautiful names because of the type of practice they've run. And that's what we want to be. We want to be that family dermatologist that you can go to, and not like a brand that is known for having 50 billion outlets.
Being extra commercial.
We would like to be the, more of the, like we do the procedures, we do the consults, we do, we don't hand it off to any staff or anyone to take care of you and what have you. Whereas if you go into different types of clinics, I won't name names, but you go into them, someone greets you, they take you in, the doctor consults you, and then you're out the door. Someone else does the treatments for you, someone else does the chemical peels for you and whatever. And the prescription is n number of things where you pay 10 rupees for the treatment, you're paying 20 rupees for the products which are required at home after. Granted, yes, to maintain what has to be done, you have to spend a little. And it's not spending, it's more of an investment on your skin, we say. So
what's like the future for Nava? What do you think?
Oh, wow. Like, I just want to get to a place where, for Nava, where it's not many outlets per se across the country or something like that, but in the sense that even if it's 2-3 more, and maybe like a skin hospital where we can do skin grafts, and skin donation and stuff like that. Here you have blood banks. There's nothing like a skin bank. There's only 2 in the country, I think. It would be great to have one in Hyderabad, having a skin bank here, and where we can give it for burn victims or patients with vitiligo who want to do graft surgeries for replacing the loss of melanin in their skin. But Nava itself being a thing, I would love to have like another, maybe in the future, 3 or 4 more dermatologists tagged on as a team, have 2 or 3 outlets, and that's it. But each circulates through all. I use my mom as an example. She's a pediatric neurologist. She has about like 4 private practices in Long Island, New York, and she makes sure that she visits all of them. All her patients are seen by her only, and she never hands off to anyone. You know, your client is your client. They're coming to you because they trust you. They trust Nava, but it's not that any doctor in there wants to be. You're comfortable.
You have to maintain that personal touch.
Yeah, of course. Yeah. You want to keep it on the low key, and some people don't want their names to be told outside. And in America, we have something called HIPAA. Here, we have something called nothing. There's nothing as confidentiality here. You know, it's namesake. So in aesthetic practices, of course, people are much more careful about, you know, my name shouldn't be revealed. No one should know that I came here and did treatment.
Fine.
You know, whether it's an actor, a politician, or even just a normal computer techie, you know, he just wants to come, get something done, and doesn't want anyone to know. Of course, there are procedures that have downtime, which means that show that something is visible as happened to you, and then those type of things you can't hide, but it's all on the client, whatever they want. But privacy is a big issue, confidentiality is a big issue. It's hard to maintain in places where if you go to a party and someone says, Naveen did some treatment for me, and then they come, hey, did you do that treatment for that guy? You have to, you say, no, I don't know, according to law, you should say, no, I don't know what you're talking about, but then you look like the Dumbo.
Why are you
exactly. My cousin once told me, he does angioplasties and he gets maybe 15,000, 20,000 in angioplasty, whereas this guy is a bariatric surgeon getting 3 lakh. He said, how can you charge this much money for a bariatric surgery, like stomach stapling? And he said, come here. All these patients here, they'll come to you and say, you're my doctor, thank you for saving me, you helped me get rid of my angioplasty, my blood is flowing better now, this and that. But those other 20, 30 patients, they're all mine, but they'll never come to me and tell me they're patient. It's confidentiality that I'm paying for. That's the biggest thing, that they're paying for the secrecy of the service and getting it done.
The hype overall.
Of course,
different industries have different things.
Yeah, I mean, but in the end of the day, removing fat or clearing a block in your artery, which is more important? Obviously clearing the block in the artery, but no one really talks about it because it's internal, it's not visible.
Great, Naveen. So thank you so much for coming down. I think
thanks.
You're in the midst of 2 beautiful careers. One of becoming a model or an actor, I should say, as an actor, and another of a dermatologist and a skin specialist, I should say. Both tie beautifully well, because you can say the skin will be as good as an actor playing yourself. But thank you so much for coming. I hope many watching you get inspired to develop something new and go through various boundaries. I think I must say you went through a bit of random,
bit of a rocky start.
But great experiences on the way, I'm sure.
I just want to say one thing before I go. It's to the audience, whatever it is, if you could start with anything for skincare, especially, it would just be that first, make sure your diet is right. Number 2 would be that you definitely have to use sunscreen in types of areas where you're prone to this type of sun exposure. And hydrate like there's no tomorrow. Don't stop, just keep drinking water. Nothing but water. Whatever goes in you is what's going to show on your skin. Don't trust every dermatologist that says they're going to do treatments in this way and get this result and everything.
Except Dr. Naveen.
Nah, even me. Don't trust me. It's all in the sense that you should be able to. Obviously, every patient that comes to you does a full Google search on their lesion or condition before they come to you, and they'll have 15 different things pointing out. Can you do this? Can you do this? So first, you have to tone them down, manage their expectation. Tell them, Google is Google. Doctor is doctor. We know what some of the etiological causes are that
Google
won't be
a search engine. It's not a doctor.
Exactly. So that's a big thing that people get irritated by. But you have to be able to know what your problem is, know what instigated it, and know that I've already came to the doctor to start getting treatment for this. And like I said, so you have to be in the right mindset that you will get into a new set of rhythm or habits. You want to start going to the gym and you start for 4 days and then stop. Same thing with skincare. You can't just stop in the middle and expect the things to be done after 4 days or 5 days of using it. It's a lifelong type of process. You got to take care of yourself. So take care of what's inside, you'll take care of what's outside.
Thank you so much, Naveen.
Thank you for having me, brother.
Thank you. Take care.